Hello and welcome to Traditional Chinese Medicine Auricular Acupuncture. My name is Christina Kapothanasis. I'm a licensed acupuncturist here in the state of Hawaii, and I am a diplomat of Oriental Medicine under the National Certification Commission for Acupuncture and Oriental Medicine. I am also the Executive Director of the Hawaii Oriental Medicine and Acupuncture Association. I'm delighted to be here today and share auricular acupuncture with you. Auricular acupuncture is just another way of saying acupuncture in the ear. Auricular acupuncture is a supplementary form of treatment modality to acupuncture and Chinese herbs under the umbrella of traditional Chinese medicine. Today we're going to show you a little bit about the points on the ear, the acupuncture points that you stimulate on the ear, how they are used as diagnostic tools and treatment methods, and we're going to demonstrate some points that maybe you can try at home for yourself. Auricular acupuncture or ear acupuncture is similar to the concept of hand and feet reflexology. I don't know if you've ever been to the massage clinics that offer different hands and feet massage. They may have shared with you the idea that your head, eyes, nose, ears, mouth are located along the fingertips. The correlation of the lungs may be here across the top of the palm. The digestive system, internal organs located more in the center of the palm. And down here at the bottom may be reproductive organs. Similarly, in the foot, the ears, eyes, head, nose are closer to the toe tips, and the lungs working their way down through the internal organs and reproductive organs at the heel of the foot. So when you press certain areas on the hands and the feet, you notice that there can be changes over time in the body. If a spot is particularly sore, that may indicate an imbalance in a different organ. And auricular acupuncture runs along those same lines. In auricular acupuncture, there are over 100 points. These points correlate to body parts, ears, eyes, nose, skeletal parts, hands, feet. We also have all of the organs, correlating organs, and we have different functional points. For example, calming points, balancing the endocrine, cooling down the body, lowering the blood pressure, etc. So these are the three classifications for the points. We can use the organs, we can use the body parts, and we can use different functions. I thought we'd start today by going over a model of the ear that I brought and showing you a little bit about where the points are located on the ear. This is a model of the ear, and if you can think about a small baby being inverted in the ear with the head down here at the lobe and the feet up here at the top, then you'll have a very good general understanding of how the points are distributed. Unlike in the hands and feet, where the head is at the top and the feet are at the bottom, the ear points are upside down. So down here we have the eyes, the tongue, the inner ear, your cheek. The points on the earlobe are corresponding to points on your head. We work our way up to the forehead and the temporal lobes, the occipital lobe of the head. Along the outside, we have the skeletal system. Along the outside, we have the neck, the thoracic vertebrae, your lower or lumbar vertebrae, coming down through your knees, your ankles, and your toes. The arms and shoulders come over here, clavicle, your shoulder joint, elbow, down to your wrists and your fingers. Inside the ear, in this inner depression, is where the internal organs are located. So again, along the same lines, the organs that are in your chest and the top of your body will be located in the lower part of the ear, and the organs in your abdomen, or the lower part of the body, will be on the top part of the ear. Down here in the very center of the depression, we have the heart. Around the heart are different points associated with different parts of the lung. If we move our way around the side, we have spleen, your stomach, your liver, your gallbladder, coming up to your kidneys, and your bladder. This part, this protrusion here that comes out, that sticks out, all around this is the digestive system. From starting with your mouth, where food enters, going down your esophagus, through your stomach, coming out your small intestines, large intestines, and all the way to your rectum and anus. So any digestive problems can be helped for points along the center of the ear here. Up here in this depression, we have also different points related to the reproductive organs, and around the outer edge is mostly for things associated with fevers or inflammation. Here on this part that sticks out of the ear here, we have adrenals, things having to do with blood pressure, hunger, and then more heart. So this is a very general understanding of the points on the ear, and I have invited a guest today to come and be our model so I can show you how we use auricular acupuncture to diagnose and treat. So if I could have my guest, another fellow acupuncturist, Nathan Zen, come with us today. Thank you so much for coming today.
Thank you. Aloha.
Please have a seat. Thank you. So we'll start with the diagnostic part of auricular acupuncture. There are 3 ways that we can diagnose using auricular acupuncture. The first one we can use is just by purely looking. If we can look closely at his ear, we can look for any signs of discoloration. We can look for different kinds of bumps, rough patches, freckles. His ear looks very clean and healthy. But I have noticed the people with, one patient with severe and chronic insomnia had a pronounced brown spot here on this top point and here, which are corresponding to different points for heat and or insomnia. That was very interesting. We can notice different rough patches, dry patches. Even the bone, the cartilage can be slightly abnormal in places if they have digestive deficiency, kidneys, somewhere along here for the spine if they have chronic problems with their upper or lower backs. So this is one way we can look, and you can look at home to see if you have any obvious bumps, patches, discolorations, and try to locate the corresponding organ and see if that is something that you're suffering from. We can also press and find tender spots. We usually do this as supplemental diagnostic method to traditional Chinese methods, usual diagnostic techniques of pulse and tongue diagnosis. So if we come down here, we usually ask the patient to tell us when they feel any tenderness or pain. So we can ask Nathan to tell us he seems quite healthy, but let's see if we can find anything wrong with him today. So we'll start by pressing on the heart point, located right here in the center of the depression, and he can tell us if he feels any discomfort. If we go around the heart point and press in a circle, we'll be checking different parts of his lungs. And he can just tell us if he feels any discomfort. You don't have to press too hard. Pressing gently and not pressing with something sharp tipped. This is a small rounded end on this metal pointer. We can see how his digestive system is, starting with his mouth and going through to his stomach, small and large intestines. So far, so good. We can see his spleen.
Mm-hmm.
It's a little tender?
Yeah, it's a little bit tender.
Okay. So we found one point that's a little tender, and that might be indicating that he has a little imbalance in his spleen. If we come up here, we can see the liver, the gallbladder, kidney, and bladder. We can see how stressed he is at this point.
A little bit.
A little tender there. We'll see how well he sleeps and his stress level. Is this one tender?
Mm-hmm.
A little bit. If we put those three together, for Nathan today, we can maybe assume that his stress level is a little high. Stress usually first affects the liver and shortly after will affect the digestive system. It attacks the spleen. So putting together the points for stress and or calm insomnia are tender with the spleen. We may just need to work on some calming points for him today and stress relief. Another way that we can check to see if the body is showing any imbalances is with the low frequency electric pulse machine. This machine has a small meter on it called point detecting, and we can use one rod that he holds in his hand, and I have another rod that I hold in my hand, and I will check the electrical resistance on the skin for all of the different points that we just did with the tender spot testing. The way that we do this is first we start to find his baseline on the top of the ear here. This meter goes from 0 to 10. The baseline, his baseline is at 2. That's where people's normally are. Now we're going to see one point at a time, and I'm going to monitor the machine. The higher the number, the more likely he is to have an imbalance in that organ. So let's start back here with the heart and see if we can find some imbalances. The heart seems good. Let's check out the lungs. We're showing a little bit of weakness in the lower part of the lungs. Tiny bit. Let's check out the digestive system. Good. The mouth is good. Esophagus, good. Stomach. Tiny weakness in the stomach. Stomach and spleen, the point that he showed with tenderness, are inseparable pair of organs, so sometimes the stomach is off. We'll usually take the spleen with it. Falling down into the, small intestines. Not too bad. Large intestines. Pretty good. So it's more concentrated in his upper digestive system, where we're seeing a little bit of sensitivity from this. Let's check the spleen point where he had some sensitivity. Yep, that goes right along with his tender point, the liver. A little bit, that goes along with the idea of stress that we were just talking about. Kidney, seems okay. Bladder, seems okay. Let's check the calm, heat, sleep points. Seems a little bit out of balance. And whoop, the top point, quite stressed. Poor young Nathan here. Don't work so hard. So what we can see is from his tender points, he showed a spleen and a couple of the heat points for calmness and or sleep. And so, as we were just previously discussing, we usually start holding our stress in our liver. When the liver binds up, we say it comes over and attacks the digestive system. Anybody that's had too much stress can usually sympathize with the idea of digestive discomforts when they're under a lot of stress. So we noticed that his spleen and stomach points were slightly out of balance, his liver and the two calm points. We have two ways of treating him today. So first of all, we can start with a little ear acupuncture. So now that we've done the diagnostic methods, we're ready for the treatment methods. We'll disinfect the ear with alcohol first. We use stainless steel disposable needles. They are as thin as a hair. And we will start with the spleen. Now, can we see? So the spleen right down here. Okay, so this is the first needle. We usually leave the needles in for about 20 minutes. It just enters the skin 1/4 of an inch. It barely goes in. Will help his liver. Let me see. I'll show you the, excuse me. I'll show you the ear model again as we do this. So the spleen point right here and corresponding on his ear over here. The liver point, these points are more of an area. So it's a small circle, a small area more than a specific point. So this is liver area right up here, which we'll do on him. There's our second needle. How do you feel? You okay?
Yeah, I'm good.
We will do the calm point of Shenmen. This point is often used for stress relief. It can also be used for help with smoking cessation, different kinds of pain. We will hopefully be able to show you a few of these points that you can try for yourself. And right on the tip top of the ear is our Jin, another point for heat and calm and pain. So we will leave those in him for his treatment for this side, and we will go to the other side of the ear, other side of the head, and see about ear seeds. Okay, we'll disinfect his ear with alcohol. We disinfect the ear with alcohol for the ear seeds too, to remove some of the body's natural oils. This way the ear seeds can stick that much longer. The ear seeds are simply a piece of tape attached to a seed. Sometimes the seeds are made of metal, they may have magnetic properties, and these are made of Chinese herbs called Wangliuxingzi. You can also use baijiezi, and the seeds are there more for stimulation than for the herbs to enter into the skin. Some of the points that I thought we would share with you today are the calming points. Everybody likes the calming points. Shenmen, the point here, if we could look at this one. This point is located, as you can see, there's a small depression, if you can feel that in your ear. And it comes up along right under this ridge and this ridge. So if you can run your finger almost to the top of that small mountain there, it's right before that. If we can demonstrate on Nathan's ear. You can see the depression in the ear right through here, coming up almost to the top, and we'll put the ear seed right in there. These usually stay on for 3 to 7 days. You can shower with them, go swimming, do your daily activities, and they'll fall off when they're ready to fall off. Another good one, an easy one to find for the calming. Not only is Shenmen good for calming, but like I said, it's good for pain. It helps release natural endorphins in the body, which are natural painkillers. It's good for sleep, and it's good for high blood pressure, different things like that. On the top, we have our Jian. It's very easy to find. It's at the tip top of the earlobe, of the ear. It's also good for reducing heat in the body. Heat is usually what makes us feel anxious or irritable. It's also usually what bothers our heart, which controls the mind and disturbs the sleep. So this one is good for stress relief, clearing heat, making us feel calm. We usually pick 2 or 3, sometimes 3 or 4 points to put, but we're going to demonstrate a few more today with you. So let's go to the endocrine system. Another interesting point that we can see down here in this depression is the endocrine system. This is another really easy point to find because it's right, if you put your finger right in this little depression here, it's right at the edge. If we can demonstrate that on Nathan. This can be for any kind of hormonal imbalances, causing a variety of problems. So it can be good for women with their periods, any kind of menstrual irregularities, cycle too long, cycle too short, too much or too little bleeding. Can help with women who suffer cramps during their period. Also could be helpful for women going through menopause and having hot flashes or night sweats. It can help with people who are overweight due to hormonal imbalance. This one can help with thyroid disorders. Anything that you can think of related to the hormones, this one will be excellent. We can also show you where the point is for appetite control. A lot of people out there would like to lose weight. If we show you on the bigger ear, this part, this flap of the ear that sticks out right here, it's where the pointiest part is, at the outermost part, and come right in towards the direction of the head. So if we put that one on him, that would look like this. You may not have ear seeds with tape at home, but even if you use your fingernail to pinch this part of your ear, right in here, you can still stimulate the point. The ear seeds are there just for convenience. So this would be another good one. There are all kinds of points on the inside that we use for the organs in terms of traditional Chinese medicine. So if we did the heart, we may use the heart for sleep. We may use the heart for palpitations. We may use the heart for calm. If we use the liver we may use for stress, because in Chinese medicine we say that the liver holds stress. The liver point over here. We may use also the kidneys for reproductive. Liver and kidneys are good for reproductive issues. In Chinese medicine, liver, kidneys, and spleen are all crucial for the reproductive organs to work properly. Stomach, if you have any specific stomach problems like acid reflux, loose stools, constipation, we can work with things even for toothache, for dizziness, for headaches. A lot of people have headaches, and the best way to stop a headache in its early stages before it gets too severe is along this ridge right here. So there are 3 points along here corresponding to the forehead, the temporal lobes, where most people start their headaches on the side, or the occipital part of the head in the back. So we will put one ear seed right on the center there in the temporal area. But even if you don't have an ear seed, like I said, if you feel a headache coming on, quickly drink a tall glass of water and use your fingernail, like so, to grab along here and pinch until you feel sore pressure. And that usually is enough to stave off headaches from starting or getting any worse. Let's see, we have some calm points, we have some endocrine points, stomach, and we reviewed the organs in the middle. Are there any other issues that you'd like us to work with today, Nathan?
I feel good now.
That's great. We usually don't put this many ear seeds, like I said, on the ear. We usually pick 2 to 4 points, and we ask patients to squeeze these once or twice a day for a minute or so. There are other calming points and, of course, other points for organs. We try to find what's out of balance, looking at your tongue, looking at your pulse, looking at the answers to your questions, and put together a complete diagnosis so we can pick the points that go specifically for you. And we can take his needles out now. We also ask the patients, especially patients working to stop smoking, we ask them to press the points whenever they feel an urge coming on. For people who are working on weight control, we ask them to squeeze the points whenever they get hungry or 30 minutes before they eat. I hope that you've learned a couple points that you can try out today for yourself. This is not intended to replace the advice of your regular traditional Oriental medicine practitioner, but I hope that you learned something fun and exciting that you can try on you and your friends, and I hope that you can be free of headaches, sleep a little bit better, and be a little bit calmer. Thank you.